Fundamentals Chapter 5. Skin Analysis. Learning Objectives. After completing this chapter, you will be able to explain the process of skin analysis, identify the 4 genetic skin types through visualization, palpation, and consultation, differentiate the 6 Fitzpatrick skin types and accurately identify them, distinguish the characteristics of sensitive skin, recognize the intricacies involved with treating skin of color, identify treatment options for the neck and décolleté, illustrate examples of skin conditions, explain the causes of skin conditions, describe healthy habits for the skin, determine treatment contraindications through evaluation, analysis, and consultation, perform a skin analysis, explain the process of skin analysis. Being knowledgeable about skin types and conditions is one of the most important competencies for AS professional. This interaction with a client sets you up as the skincare expert. Recommendations for the appropriate skincare treatments and products must be uniquely adapted to each person. The skin analysis is the determining factor in deciding what products to use during the service and what products to recommend for home use. Figure 5.1. The skin analysis also confirms whether the client is an appropriate candidate for the treatment. Skincare. Estheticians should study and have a thorough understanding of skin analysis because, before performing services or selecting products, an individual's skin type and conditions must be analyzed correctly to determine the appropriate treatment and products. A thorough skin analysis and client consultation is especially important to determine the causes of skin conditions and any contraindications to treatment or products that the client may have. Using a holistic approach, identifying healthy habits and behavior that is detrimental to skin health will give you a better understanding of how to help your clients. Identify the 4 genetic skin types through visualization, palpation, and consultation. Skin type is a classification that describes a person's genetic skin attributes. Skin type is determined by genetics and ethnicity, but like everything else, skin can change over time. Generally, skin becomes drier over time because our cellular metabolism and oil/lipid production slow down as we age. Skin type is based primarily on how much oil is produced in the follicles from the sebaceous glands and on the amount of lipids found between the cells. The T-zone is the center area of the face, corresponding to the T-shape formed by the forehead, nose, and chin. Figure 5.2. Evaluating the pores in the T-zone is the first step in determining skin type. All skin types need proper cleansing, exfoliating, hydrating, and protecting. Finding the right treatment plan for each individual can be challenging, and this makes the esthetician's role even more interesting. The focus of this chapter is to identify skin types and conditions. Mastering this skill is necessary before learning about which products and treatments to choose for each person. When we perform skin analysis, we are using our visual abilities, often under magnification, to note properties in the skin, such as pore size or irregularities in the skin, example, blemishes. We use palpation to examine the skin through touch, manipulating it to determine conditions such as oiliness and elasticity. And we use consultation, conversing with our client to determine lifestyle and dietary issues that impact the skin. You will experience more success in your profession as your skills in assessment get stronger. Skin types are categorized as follows: Table 5.1 and Figures 5, 3 and 5, 4 and 5, 5 and 5 to 6. Normal. Combination. Oily. Dry. Table 5:1. Skin type guidelines. Skin type, normal. What does it look like, feel like? Oil, balanced. Hydration, balanced. Follicle size, very small. Appearance, uniform luminosity, no or rare blemishes. Feel, soft, smooth texture, good elasticity. How is it treated? Maintenance and prevention treatments. Use 4 steps to skin health. Cleanse, exfoliate, nourish, protect. Why? Body systems functioning holistically for balance. Most common in 20s and 30s. Expert tips. Introduce anti-aging products as client matures. Normal skin will often become drier with age. Reinforce use of sunscreen. Skin type, combination. What does it look like, feel like? Oil, moderate to high. Hydration, good to dehydrated. Follicle size, larger in T-zone than cheeks and sides of face. Appearance, can have buildup of dead skin and oil in pores around nose but dry or flaking skin outside of T-zone, some blemishes and comedones. Feel, oilier in center T-zone than sides of face. How is it treated? Cleansing and regular exfoliation. Water-based products. Avoid harsh products and rough exfoliation. Why? Overproduction of oil in the T-zone. May have normal oil production in the T-zone and dehydrated skin on the sides of the face. Expert tips, evaluate often, as oil hydration balance can be disrupted by hormonal and environmental influences. Reinforce use of sunscreen. Skin type, oily. What does it look like, feel like? Oil, moderate to high. Hydration, good to dehydrated. Follicle size, moderate to large. Appearance, shiny, comedones and blemishes may be present. Feel, thick and firm, uneven due to congestion. How is it treated? Regular cleansing and exfoliation and hydrating with water-based products. Treatments to balance oil production. Why? Overproduction of oil due to genetics, hormonal changes, medication, stress, or environmental factors, such as skincare products or makeup that are comedogenic. Overexfoliation can create oilier skin as sebaceous glands work to increase surface dryness. Expert tips, clients with oily skin breakouts and comedones may have them on the neck, back, shoulders, and chest. Clients with oily skin age more slowly, since the oil acts to protect the skin. Clients will need to use SPF regularly to avoid post-inflammatory hyperpigmentation, a common ailment that accompanies acne. Skin type, dry. What does it look like, feel like? Figure 5.3. Learning to identify skin types will help you formulate the best skincare treatment plan. The oil hydration balance is easily affected with combination skin. Figure 5.4. Oily skin ages more slowly because the oil acts to protect the skin. Figure 5.5. Dry skin can have compromised TEWL. Figure 5.6. Normal skin often changes as we age. Check in. Are skin types genetic? List the skin types. What is dry skin lacking? What is skin typing based on? Differentiate the 6 Fitzpatrick skin types and accurately identify them. Developed by Dr. Thomas Fitzpatrick, the Fitzpatrick scale is used to measure the skin type's ability to tolerate ultraviolet, UV, exposure, Table 5.2. Many skin treatment protocols are based on the client's Fitzpatrick skin type. Due to racially mixed genetics, there is no true phototype classification system, therefore, the scale is just a guideline. Table 5.2. Activity. Skin deep. Use your cell phone to create a collage of the 6 Fitzpatrick skin types and send it to your instructor. When it comes to skin treatments, everyone's level of skin reactivity is different. Lighter skin types are generally more sensitive. Individuals with dark skin have larger melanin deposits in the stratum corneum, SC, which gives more protection from the sun, but dark skin types face other risks. Adverse reaction like hyper or hypopigmentation and keloid scarring may occur due to aggressive treatments. Other skin classification systems. There are other classification systems used when evaluating the skin, but Fitzpatrick is the most commonly used. You may want to research other resources for information on the Glogo scale and the Rubin scale. Activity. Classification scales. Research the Rubin skin scale and/or the Glogo scale. Create a poster describing these skin scales. Check in. What is the Fitzpatrick scale? Identify the reaction to UV exposure for each Fitzpatrick skin type. Distinguish the characteristics of sensitive skin. We are constantly bombarded by environmental stimuli, stress, sun exposure, and other unhealthy elements. Sensitive skin is a condition but can also be genetically predisposed, Figure 5.7. Sensitive skin is characterized by fragility, thin skin, and redness. Clients with a heritage that is Northern European, Fitzpatrick skin type 1, tend to have fair, light-colored skin that is thinner and more sensitive. It flushes easily and may appear red due to the blood flow being closer to the surface. Individuals with multicultural skin can also be naturally sensitive, without the visible redness. Figure 5.7. Any skin type can be sensitive. Sensitive skin is easily irritated by products or by exposure to heat or sun. Telangiectasia, visible broken or distended capillaries less than 0.5 mm due to intrinsic or extrinsic causes, may be noticeable on sensitive skin. These conditions are a protective visible reaction to let us know something is irritating the skin. Fragile or thin skin can also be the result of age or medications. Skin can become reactive and sensitized from exposure to things such as harsh products, heat, or even become dehydrated and chapped from cold weather. Sensitive or sensitized skin can be difficult to treat because of its low tolerance to products and stimulation. For example, excessive rubbing, heat, exfoliation, or extractions can cause damage and increase redness. Sensitive skin needs to be treated gently with non-irritating, calming products and treatments. It is important to find out what could be causing sensitive conditions by completing a thorough skin analysis. Is it a natural part of their skin condition, or is it something the client is exposed to? Primary treatment goals for sensitive skin are to soothe, calm, and protect. Check in. In addition to a genetic predisposition, what can cause skin to become reactive and sensitized? Why is sensitized skin challenging to treat? What are the goals for treating sensitized skin? Recognize the intricacies involved with treating skin of color. All Fitzpatrick skin types have the same number of melanocytes. Higher Fitzpatrick skin types have melanocytes that produce more melanin. Melanocytes comprise about 5 to 10% of the cells in the basal layer. Most of the differentiation is dependent on the ethnicity of the individual and their geographic location. A person who lives along the equator will have much more active melanocytes than the person who lives at the North Pole. In addition to these considerations, each of these skin types has specific characteristics. Fitzpatrick skin type 4. Considered to be one of the most challenging skin types to treat well. Has great elasticity and firmness and does not show signs of aging as quickly as Fitzpatrick skin types 1 and 2. Can become hyperpigmented from treatments or aggressive exfoliating agents. Gentler exfoliating products are recommended. May need to add melanin suppressants or other skin lighteners to skincare routine. Requires sun protection to slow down hyperpigmentation. Must avoid sun exposure and use sun protection daily. For anyone prone to hyperpigmentation. Fitzpatrick skin types 3 and 4 typically have thicker skin that is usually characterized by more oil production and needs more deep cleansing treatments. Additionally, waxing is more difficult for individuals with any Fitzpatrick skin type that has thicker hair and thicker roots in the follicle. If you want to specialize in skin of color, explore educational resources and advanced classes for this area of study, Figure 5.8. No matter what a client's skin type or ethnic background, everyone needs an individualized skincare consultation and treatment plan to maintain healthy skin. Figure 5.8. Fitzpatrick skin types 5 and 6. Generally have oilier and thicker skin, dermis, but can have the same level of reactivity as lower Fitzpatrick skin types. Reactions may be more challenging to see on darker skin, but they may be just as intense as those on lighter skin. Are prone to a form of hyperkeratosis known as ichthyosis and dead skin cell buildup, so those clients need more exfoliation and deep pore cleansing. May have abnormal hypertrophic scarring, keloids. Sun protection still necessary for these skin types. Check-in. Why do clients with higher Fitzpatrick skin types have darker skin? How can you treat the hyperkeratosis that is common in Fitzpatrick skin types 5 and 6? Which Fitzpatrick skin type is often considered the most challenging to treat? What treatment can be difficult for a client of any skin color who has thick hair and thicker roots in the follicle? Identify treatment options for the neck and décolleté. The skin on the neck and décolleté, pertaining to the lower neck and chest, is not the same as the skin on the face. The neck and décolleté have fewer sebaceous glands than the face, so they tend to show aging more quickly, figure 5:9. The neck and décolleté are more susceptible to irritation. Photodamage, broken capillaries, fine lines, and rhytids, wrinkles, develop just as much on the neck and chest as the face. Tech neck, a new phenomenon caused by the repeated movement of looking down at a cell phone or other electronic device, has created a demand for specialty topical treatments that include antioxidants, growth factor serums, and additional moisture. Be cautious when applying vitamin A or alpha hydroxy acid, AHA, products that may cause excess irritation to the area. A product, such as a retinol, may be fine for the face but may be too aggressive for the neck. Remind your clients that the neck and décolleté need SPF protection as much as the face does. Figure 5:9. Often the neck and décolleté can reveal aging more than the face. Check in. Why do the neck and décolleté show aging more quickly than the face does? What is tech neck? What kind of products should be used on the neck and décolleté? Illustrate examples of skin conditions. Many internal and external factors affect the condition of a person's skin. Skin conditions are more than our genetic makeup. These conditions are what the esthetician is most concerned about, and they are the focus of skin treatments. Some of the most common skin conditions estheticians see today are adult acne, extrinsic aging, from sun exposure in the environment, and problems related to hormonal fluctuations. Dehydration and pigmentation disorders are also significant concerns to clients. Other skin conditions include comedones, hyperkeratinization, and erythema, redness. We can improve some of these conditions through regularly scheduled skin treatments, by using specialized products, and by avoiding the factors that affect the conditions. On the client's chart, you will want to note other conditions that may not be listed in Table 5:3 and that you learn about here and in Chapter 4, Disorders and Diseases of the Skin. Table 5:3. Skin conditions and descriptions. Acne, sebaceous breakouts from hormonal changes or other factors. Actinic keratosis, a rough area resulting from chronic sun exposure, sometimes with a layered scale or scab that sometimes falls off. Can be precancerous. Aging, characterized by skin laxity due to collagen and bone loss, thinner skin, dryness, photodamage, and fine lines or wrinkles. Asphyxiated, smokers have asphyxiated skin from lack of oxygen. Characterized by clogged pores and wrinkles, dull and lifeless looking. Can be yellowish or gray in color. Comedones, open comedones are blackheads in clogged pores caused by a buildup of debris, oil, and dead skin cells in the follicles. Closed comedones, also called whiteheads, are not open to the air or oxygen. They are trapped by dead skin cells and need to be exfoliated and extracted. Couperose skin, redness in the skin with no visible vascularity because the matting of blood vessels is so small and fine. Often seen with telangiectasia. Cysts, fluid, infection, or other matter under the skin that is encapsulated into a palpable firm mass of varying sizes, from a pea to a golf ball. Dehydrated, lack of water caused by the environment, medications, topical agents, aging, or dehydrating drinks such as caffeine and alcohol. Enlarged pores, larger follicles due to excess oil and debris trapped in the follicles or expansion due to elasticity loss or trauma. Erythema, redness caused by inflammation. Growths, skin cells and underlying tissue that overproduce and create an area that could be raised or flat, but can be distinguished with palpation. They may be the same color as surrounding tissue or may be pigmented. They can be present at birth or develop later. Herpes simplex I, a communicable virus that appears as a vesicle on the lip similar to a blister. Find more information in the chapter on diseases and disorders of the skin. Hirsutism, excess body hair located in regions where hair is not normally present, such as facial hair for women. It is commonly caused by a hormonal imbalance. Polycystic ovarian syndrome, COS, is a possible cause of hirsutism. Signs and symptoms of COS include irregular or no menstrual periods, heavy periods, excess body and facial hair, acne, pelvic pain, difficulty getting pregnant, and patches of thick, darker, velvety skin. Hyperkeratinization, an excessive buildup of dead skin cells/keratinized cells. Hyperpigmentation, overproduction of melanin due to at least one of three factors. UV exposure, from the sun, tanning beds, fluorescent lighting. This usually appears as diffuse brown spots of various shades on the skin. Hormonally induced, also called melasma, refer to description in table. Post-inflammatory hyperpigmentation, also called PIH, occurs from a surface injury to the skin. Acne lesions, insect bites, and ingrown hairs are common causes of PIH. They can appear deep red, almost purple, to dark brown in color. They can gradually fade. Hypertrichosis refers to any excess hair growth, whether it is caused from a hormonal imbalance or heredity. Hypopigmentation, lack of melanin production due to four possible factors. UV-induced, intermingled with UV-induced hyperpigmentation. No treatment options, but lightening the hyperpigmentation will usually blend the hypopigmented areas so they are less noticeable. Post-traumatic, lack of melanocyte production due to an injury, burn, or other trauma, including a deep chemical peel. Melanocytes may begin producing again over time, but the length of time is undetermined. Vitiligo, an autoimmune disorder that stops melanocyte production, creating patches of depigmented skin. Topical prescription drugs can occasionally trigger rejuvenation of the melanocytes. Albinism, a hereditary disorder causing lack of pigment in the eyes, skin, and hair. Irritation, usually redness or inflammation, from a variety of causes. Keratosis pilaris, a buildup of cells, a rough texture. Melasma, a form of hyperpigmentation that is characterized by bilateral patches of brown pigmentation on the cheeks, jawline, forehead, and upper lip, due to hormonal imbalances, such as pregnancy, birth control pills, or hormone replacement therapy. Melasma gets worse with sun exposure. Milia, hardened, pearl-like collections of oil and dead skin cells trapped beneath the surface of the skin. Milia are not exposed to oxygen and have to be lanced to open and remove them. Milia are typically the size of the head of a pin. Note: check with your state board, as lancets are not approved for use in all states. Papules, raised lesions, also called blemishes. Poikiloderma of civet, a result of chronic sun exposure, specifically along the sides of the neck, which turn a reddish-brown color with a clear demarcation of untanned skin under the chin. Poor elasticity, skin laxity from damage, sun, and aging. Pustules, an infected papule with fluid inside. Scar, a mark on the skin where a wound, burn, or sore has healed and left a fibrous band of connective tissue, sometimes hyperpigmented or hypopigmented. Sebaceous hyperplasia, benign lesions seen in oilier areas of the face, described as looking like donut holes, cannot be extracted. Seborrhea, also known as seborrheic dermatitis. Excess oil production that causes redness, irritation, and flaking. Occurs most commonly in the hair as dandruff. Sensitivities, physical reactions, such as erythema, edema, wheals, itching, stinging, or discomfort, from internal or external influence on the skin. Solar comedones, large open comedones, usually around the eyes, due to sun exposure. Striae or stretch marks, dermal scars due to rapid expansion or stretching of connective tissue leaving deep red, pink, or purple linear marks on the skin that gradually fade to light pink or silver over time. They often occur during growth phases in puberty, pregnancy, and weight gain. Sun damage, UV damage to the epidermis and dermis. Primary effects are wrinkles, collagen and elastin breakdown, pigmentation, and cancer. Telangiectasia, visible broken or distended capillaries less than 0.5 mm due to intrinsic or extrinsic causes. Wrinkles/aging, ridges, lines and damage from internal or external cause. Activity. Quiz yourself on skin conditions. Create flashcards to help you learn about skin conditions. Check in. How are skin conditions different from skin types? List and define 15 common skin conditions. Explain the causes of skin conditions. Being aware of what can affect the skin will help you determine why a client may be experiencing problems. Often skin conditions are due to more than one influence. The esthetician must evaluate multiple causes, both external and internal, to correct or improve a skin condition. Figure 5.10. Each client is different, and the skin of various clients may respond differently to the exact same treatment. External factors that affect the skin. Habits, diet, and stress all play a part in our health, which in turn is reflected in our skin's appearance. Skin conditions can be caused by allergies/reactions, medications, medical conditions, and other external or extrinsic factors. Additionally, lack of exercise, lack of sleep, smoking, medications, and drugs will have negative effects both inside and out. Sun damage is the main external, extrinsic, cause of aging. These factors can also contribute to skin problems and can be detrimental to maintaining a healthy and attractive complexion. As you read through the following chart, you can understand why correct skin analysis and product and treatment recommendations are so important. External effects on the skin. UV exposure, sun damage. Tanning beds. Environmental exposure, pollutants, air quality. Environment, climate, humidity. Poor maintenance, inappropriate skin care. Misuse of products or treatments, overexfoliation, harsh products. Allergies and reactions to environmental factors or products. Photosensitivity to the sun from medications or products. Internal factors that affect the skin. Our body's internal, or intrinsic, health affects how we feel as well as how our body and skin look and perform. Free radicals, unstable molecules, in the body, dehydration, lack of water, vitamin deficiencies, improper nutrition, genetics, hormones, puberty, pregnancy, and menopause all affect our skin's well-being. Hormonal imbalances can lead to sensitivity, dehydration, hyperpigmentation, and microcirculation problems that affect capillaries. Internal effects on the skin. Genetics and ethnicity-influenced conditions. Free radicals. Dehydration. Vitamin deficiencies. Hormones. Medical conditions such as chronic illness, cancer, systemic diseases, diabetes, impaired immune function. Puberty. Aging. Glycation alters protein structures and decreases biological activity. Pregnancy. Menopause. Activity. Protect what matters. Download a Sun Factor app on your phone and tell your classmates how it helps to protect your skin from the sun. Check in. List 4 intrinsic or internal factors that affect the skin. List 4 extrinsic or external factors that affect the skin. What is the main cause of premature extrinsic aging? Describe healthy habits for the skin. Top 10 healthy habits for the skin. Avoid sun exposure, use sunscreen daily. Eat a balanced diet. Do not smoke. Avoid excessive alcohol. Drink plenty of water. Get plenty of rest. Stay active and exercise regularly. Use beneficial skin care products and a regular home care routine. Get professional skin care treatments to maintain the results of your home care regimen and to more effectively treat the signs of aging, blemishes, or other skin conditions. Implement stress relievers and maintain a calm, positive attitude. Check in. What are 5 healthy habits for the skin? Determine treatment contraindications through evaluation, analysis, and consultation. Certain treatments and skincare products may be contraindicated for a particular client, and it is your responsibility to evaluate the appropriateness of treatment and skincare products after your skin analysis and review of the client's medical history. These contraindications are factors that prohibit a treatment from being performed or the use of a certain skincare product being used on a client's skin. Certain treatments could cause harmful or negative side effects to those who have specific medical or skin conditions. Communicable diseases, skin disorders, medical conditions, medications, and skin irritation can all contraindicate or prohibit a service or use of a skincare product. The client may list a communicable disease on the client questionnaire. Recognizing diseases is vital to avoid causing harm to clients or to you. Medications or topical exfoliating agents may make the skin too sensitive for facials or waxing. Certain medical conditions, illnesses, and diseases, such as cancer, may contraindicate any stimulation to the face or body. Allergies and sensitivities to skincare products must be evaluated. Clients who have obvious skin conditions such as open wounds, cold sores, herpes simplex, or other abnormal-looking conditions should be referred to a medical provider for evaluation and approval for aesthetic treatment. Contraindications are also discussed in other chapters. Contraindications for skin treatments. Certain skin diseases, disorders, or irritations must be considered individually based on the client's overall health. Use of isotretinoin. The client must have completed isotretinoin 6 months prior. Skin thinning or exfoliating topical medication, including Retin-A registered, Renova trademark, Tazorac registered, Differin registered, or other forms of vitamin A. Avoid waxing, exfoliation, and peeling treatments for a minimum of a week. Pregnancy, no electrical treatments, chemical peels, or aggressive ingredients, without the client's medical provider's written permission. Some pregnant clients may experience sensitivities from waxing. Metal bone pins or plates in the body, avoid all electrical treatments in the area where the pin or plate is located. Medical professional consent is needed prior to treatment. Pacemakers or heart irregularities, avoid all electrical treatments that require a grounding pad. Allergies, any allergic substances listed on the health history form should be strictly avoided. Become knowledgeable about ingredients. Clients with an allergy to aspirin should not use products or have treatments using salicylic acid. They are both derived from willow bark. Clients with multiple allergies should use fragrance-free products designed for sensitive skin. Seizures or epilepsy, avoid all electrical and light-based treatments that pulsate. Medical professional consent is best prior to treatment if the client has a history of seizures. Use of oral steroids, cortisones, such as prednisone, avoid any stimulating, exfoliating treatments or waxing, as skin may be more fragile and bruise easier until the client has been off medication for a minimum of 2 weeks. Autoimmune diseases such as lupus, vitiligo, avoid any harsh or stimulating treatments or skin care products. Diabetes, people with diabetes who do not have good control of their insulin levels will experience slow healing. If people with diabetes are experiencing neuropathy, nerve damage to the extremities, they may not feel pain in the affected area. If you are in doubt, get approval from the client's medical provider before treatment. Blood thinners, including NSAIDs, use caution when performing extractions or when waxing. NSAIDs are non-steroidal anti-inflammatory drugs, over-the-counter medication used to reduce inflammation, such as ibuprofen. Client consultations. A thorough client consultation is important for many reasons. The most important is to determine that a treatment is appropriate for the client or that the skin care products will benefit the client's skin. A consultation will help you to determine why a client may be unhappy with their skin or appearance. Health, lifestyle, occupation, and more affect the skin. Sometimes estheticians are like detectives, trying to determine why the client is having a certain skin problem. The more you know about your client, the more you can make appropriate recommendations for skincare and treatments. Reminders on how to prepare for the client consultation. As learned in Milady Standard Foundations, it is important to be prepared. To facilitate the consultation process, you should ask yourself the following questions. Is the client comfortable? You are about to begin an important conversation with them that will clue you in to their needs and preferences. Is your work area freshly cleaned and uncluttered? Are all other appropriate tools to perform the desired service ready for use? Do you have a pen or laptop/tablet along with vendor-supplied or salon-manufactured pamphlets, photos, articles, or clinical research papers? These items will help you to present the services or explain the benefits of certain ingredients that will be used to perform a treatment. Do you have step-by-step photos of the actual treatment process? Photos can be helpful in letting clients know what to expect. If you have a satisfied client whose progress is significant, it is extremely important to gain their permission to use such photos for promotional purposes. Will you be able to discuss whom the best candidates are for specific treatments to help decide if the treatment is suitable for a client? Forms. You should have at least 3 forms for a new client. Intake form, also called a client questionnaire, health history form, or consultation card. Clients should complete a confidential intake form that should be updated at each visit. The form discloses the client's healthy history, all products and medications, medical conditions, any known allergies or sensitivities, along with their at-home skincare program, and skincare treatments the client has recently received that could adversely affect treatment. Information should also include important details about the client, including their name, age, optional, occupation, diet, and lifestyle habits. Refer to Figure 5.11 for a sample intake form. Figure 5.11. Consent form, also referred to as to consent to treat release, a customary written agreement between the esthetician and the client for applying a treatment, whether routine or preoperative. Figure 5.12. The client reads and signs the document, acknowledging that they understand what is being done to them as well as the risks involved in the treatment and releasing you from liability before you perform services. Client chart or service record card, a record of all your notes from the skin analysis, the type of treatment performed, products used in the treatment, goals you are working toward, your home care recommendations, and other consultation notes. Figure 5.13. This information will be needed for future visits. How to use the client intake form. The client intake form should be mentioned the moment a new client calls the skincare salon or spa to make an appointment. When scheduling the appointment, let the client know that you and the salon will require some information before you can begin the service. Some salons ask clients to arrive 15 minutes before their appointment time for this purpose. You will also have to allow time in your schedule to conduct a 5 to 15-minute client consultation, the verbal communication with a client to determine desired results, depending on the type of service you will be performing and the client's needs. Some schools or facilities ask clients to sign and date the intake form, especially when more advanced procedures are involved, while other facilities use the consent form for this purpose. How to use the consent form. When introducing the consent form to clients, take time to review all the steps involved in the treatment process. Be sure to carefully explain any home care directions that may be necessary. Provide the client with a copy of the consent form, and keep the original for your files. It is also wise to maintain a treatment log and have the client initial and date all subsequent treatment procedures. These extra precautionary measures go a long way in safeguarding both you and the client. Questions to ask during the consultation. Common questions include the following. What is the reason for your visit? What brought the client in? Is it for a treatment or just relaxation? What are your skin concerns? What are they bothered about? What are your skincare goals? Are you preparing for a special event? When is it? What is your home skincare routine? How many products does the client use at home? What are the ingredients, and how often are they used? Have you had treatments before? Is this the client's first treatment of this type? Do you have allergies to products or scents? Is this a normal state for your skin? Is it normally clearer? Is it usually less irritated? How does your skin feel during different times of the day? What is the degree of oiliness or dryness? Do you wear sunscreen? What is the SPF value? Tell me about your diet. Do you eat a healthy diet? How much processed food do you eat? How often do you eat out? How much water do you drink? What is your activity level? Are you often outdoors? Do you smoke? Any other allergies? How stressful is your lifestyle? Are you under a lot of stress right now? Have you had any aesthetic procedures prior? How long ago? Are you happy with the results? The skincare consultation and skin analysis is your moment to make the clients aware of what you note about their skin condition, and what services or products you offer that could benefit them. The consultation is also a marketing and educational opportunity to introduce services and products to the client. Once you learn about ingredients and start performing skincare treatments, you will be recommending products. Think about how you can help the client through treatments, home care suggestions, and preventative measures. Conduct the consultation, discuss what you see with the client, and give recommendations during the analysis or after the treatment. It is beneficial to practice skin analysis before diving into products and treatments. Each subject you study gives you a foundation to build upon for the next step. Check in. List 6 contraindications for facial treatments. What 3 forms are needed for interaction with a client? List 8 questions you would ask a client during a consultation. Perform a skin analysis. Knowing how to analyze skin is the first step in providing successful skincare treatments and recommending effective skincare products. Identifying conditions and contraindications, as well as providing thorough consultations and charting client notes, are all elements of good aesthetic practices. Educating clients on healthy habits and the causes of skin conditions is part of the service. Products, ingredients, different types of facials, and a home care regimen for preventative maintenance are all beneficial in caring for the skin. A series of treatments may be necessary to effectively help the client's conditions. 20 years of sun damage cannot be helped overnight. Realistically, it could take weeks or months to see a visible difference in the skin. Even if there is no obvious visible change, skin care treatments have positive benefits and make a difference. Information on choosing products for treatments and home care is presented in Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. Skin analysis may seem challenging, but practice and experience will build confidence in using this essential skill. Soon you will automatically notice skin conditions. Become adept at a quick skin analysis in the waiting room because sometimes clients need quick product recommendations or are not sure what type of treatment they should schedule. This skill can be very beneficial in selling products or treatments. You can perform a more in-depth analysis when the client comes in for treatment. Knowing skin types, conditions, and the factors affecting the skin's health, as well as interview skills that encourage your client to open up about their skincare regimen, enables you to perform an accurate skin analysis. The best tool for analyzing the skin is a magnifying lamp/light. A Woods lamp is a filtered black light that is used to illuminate skin disorders, fungi, bacterial disorders, and deeper levels of pigmentation, discussed in Chapter 10, Facial Devices and Technology, or an electronic photo imaging system. Other handheld tools such as a moisture analyzation meter and devices that magnify hundreds of times are available to analyze the skin. Activity. Customize the skin analysis. Perform a skin analysis and practice consultations with fellow students. Complete mock health history forms with a variety of information that would be pertinent in a skincare consultation. Document your findings and record your recommendations. Client information is personal and confidential, so be objective when you write on a client's chart. Clients will appreciate you remembering their children's names or their recent trip to Hawaii, so try to recall some personal information the next time they come in and keep it in a separate file for your own personal reference. Your records could be legal documents in a dispute with a client. Write legibly. Make sure you date all entries and sign your name. Perform. Procedure 5-1 Skin Analysis. Check in. Describe the steps in a skin analysis procedure. What are the areas that the esthetician needs to review during the skin analysis? Procedure 5-1, Performing a skin analysis. Implements and materials. Gather the following supplies and products. Supplies. EPA-registered disinfectant. Hand sanitizer or antibacterial soap. Covered trash container. Bowl. Spatula. Hand towels. Headband. Clean linens. Bolster. Single-use items. Gloves. Esthetics wipes 4x4 for cleansing, or disposable sponges. Cotton rounds. Cotton swabs. Plastic bag. Paper towels. Tissues. Products. Eye makeup remover or cleanser. Facial cleanser. Toner. Moisturizer. Topical sunscreen. Preparation. The 4 components of skin analysis are look, feel, ask, and listen. Record your findings. Procedure. 1. Review the client's health history questionnaire. Look for medical conditions, medications, allergies, or other indications that the client is not an appropriate candidate for treatment. While you are reviewing the documentation, ask your client questions for clarification, if necessary. 2. Wash your hands as instructed in Milady Standard Foundations, Procedure 5-1, Proper hand washing. 3. Look briefly at your client's skin, including the neck and chest, with your naked eye or a magnifying light. In order to achieve a more accurate analysis, you will need to remove your client's makeup in the following step. 4. Cleanse the skin. A client's normal state of dryness or oiliness may not be as visible immediately after cleansing. 5. Cover the eyes with eye pads. Make sure the eye pads are not too large or they may block the eye area you need to analyze or treat. 6. Use a magnifying light to examine the skin more thoroughly. A Woods lamp or electronic imaging system can be used here. 7. Look closely to determine the client's skin type, the conditions present, and the overall appearance. 8. Touch the skin with the fingertips to feel its texture, its oil and water content, and its elasticity. Pay attention to the T-zone. 9. Ask and listen. Ask questions about the skin's appearance, the client's health, and their lifestyle to gain a better understanding. Verbally describe to your client what you are finding in your analysis. 10. Apply a toner and moisturizer or sunscreen to balance and protect the skin. 11. Recommend a skincare plan that includes professional treatments and skincare products for a home care regimen. Giving the client a treatment plan in writing and including some skincare samples is a way to build your clientele. Refer to Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. 1-2. Record your findings and your recommendations in the client's chart, usually after the treatment is completed.